Good afternoon. Hello, welcome. So, welcome to our first Elder Care Lunch and Learn for the fall semester. This one, we're going to be talking about Medicaid and Medicare. And we have a guest with us today. Her name is Guice. She is our Director of Policy and Operations for Medicaid. And she'll tell you a little bit more about herself as we go along with this presentation. Also, we do have some people joining us on Zoom. And so we have the chat option that we'll be taking questions from our Zoom participants at the end. But for you guys in the room, if you have a question as we go along, if it's a particular topic that she's talking about and you have a question, she's willing to take those questions immediately. Or you're welcome to wait until the end as well. All right, so thank you for joining us.
Okay, I'm going to take a minute and attach all these things, okay? Okay, that might not go. This will go. This isn't for you all. As Etta told me, it's for the people on Zoom. So you let me know if they can't hear me, okay? As Etta said, my name is Guice. I work in Frankfurt. And for those of you who are familiar with the bureaucracy of state government, I'm supposed to say I'm from Frankfurt and I'm here to help, which means it's going to be horrible. However, I put my jacket on because, I want you to know that I dressed professionally out of respect for my audience and for your time to listen and learn about a little bit about Medicaid. But at any moment, I might have to take it off because I have a tendency to get a little bit hot sometimes. So I just want you to know that it's nothing personal. I've been schooled at least to put the jacket on. That's what they tell me. I don't do it very well. So Medicaid is a very complicated topic and subject. Since the section of work life was elder care, I'm going to talk about long-term care benefits and adult Medicaid. Adult Medicaid is what we call it inside all the offices. It's really about Medicaid for nursing home stays, and we also have a Medicare savings program that I know a little tiny bit about, and I can talk to you about it and show you some information about it. But one thing I always can do is take questions back with me and get back to you with a response. All right? Okay. How do you apply for Medicaid, for long-term care benefits, for anything? First, you can get a little bit of information off this website. Unfortunately, it doesn't really look like this anymore because they've changed it all. But I can't find the new stuff, so I can't show it to you. But this right here, this URL is good. So you can use that and get to the place to find out this information. I looked at this slide presentation yesterday, added some stuff, tweaked a little bit. I didn't even think about the new website, so I apologize. And there are a lot of things on there that you may not be familiar with, like these forms. It's an important thing in Frankfurt that if we have something that we put an acronym on it, or else it doesn't count for anything. So MAP, I think, stands for the Medical Assistance Program, which is what Medicaid is known as in statute. So that's clearly important. But anyway, so how you apply for Medicaid, any kind of Medicaid, is to start out in any of these places. Benefind is our self-service portal. It's our integrated eligibility system. You can get to it at benefind.ky.gov, and you have to create, if you're going to go there, you have to create an account. To create an account, we're going to have to put you through what's called remote identity proofing. Don't be alarmed. These people already have your information. You can be alarmed about that if you want to. But what happens is that at a certain point in creating the account, it will ask you some questions. You'll have to click on something, and it'll ask you some questions. Things like, have you ever owned one of these cars? And it'll list 5 cars. Have you ever lived in one of these places? And it'll list some addresses. So if you answer that correctly, then the system can know that you are who you say you are. It's a security issue. This system has a lot more security on it because we have access to federal data to run some eligibility things with. And they are very, very serious about their security. Now, the self-service portal, Benefind, is available 24/7. I suggest if you want to apply, if you think maybe you're going to, go that route. None of it is easy. None of it's going to be a piece of cake, but at least that route, you can access it anytime you want to. Now, of course, I'm going to say, except September 7th, no, December 7th, and for the weekend, Pearl Harbor Day and for the weekend. They got a big release going. So as long as technology is working, though, it's working. The DCBS office, some of you may know it as the food stamp office, the Medicaid office. DCBS stands for the Department for Community-Based Services, which they do everything from child and adult protection, foster care, they issue food stamps, cash payments, KTAP, and they also determine Medicaid eligibility for us. And I say us meaning the actual Medicaid agency. Why? Because they have office in every county. And we just got the self-service portal and internet access for applications and eligibility in 2014, 15, 16. It continues to evolve, and there are more things in there. You can apply for any benefit almost that the cabinet issues through this system. So it's there for you. They also have a telephone number. It's a be prepared for a long hold most of the time. There's probably a minute or two during the day that they are able to get to you faster. And don't call after 3 because you're probably not going to get through then. Those are the big caveats. Now, not very many people know about a home visit. If you cannot get to the office or the telephone or any other way, you can call DCBS and arrange for them to come to you. It doesn't happen often, but it is available. They'll ask you a whole lot of questions about it. Okay. Uh-huh. Okay. In 2017, we got rid of the requirement for an face-to-face interview. So you don't have to speak to anyone and you don't have to go into the office if the happy path happens. Even you can even, slide back a little bit from the happy path. So good question. For adult Medicaid, okay, for most of the rest of Medicaid, you are determined eligible based on your income. We refer to that methodology. It was implemented when the Affordable Care Act went into full implementation in 2014. And it's a version of the modified adjusted gross income that you all have heard of, I hope. It's on your tax form. It's not that number, but it's close to that number. So everybody calls it the MAGI methodology. However, it does not apply to these benefits. Adult Medicaid has to have an income and a resource test. Your income can't exceed $2,250 a month. It's not a lot, but it's more than, you know, it would be if you were trying to get Medicaid by yourself. Your resources can't exceed $2,000 total amount. Savings account, CDs, life insurance policies that have a cash value. Your home is excluded. You can have a car with a certain amount of value to it, but it's excluded from your resource, this right here. Now, I say that because, but there's a, let me be clear. Everything I say, there's a but. Almost everything, okay? So if you need to ask a question about it, or you think, how can that be? The home is excluded. We expect you to sell it. Okay. Now, if you're married and you have a spouse and one of those people is going into the nursing facility, I cannot even talk to you about how complicated it is. Because the calculations, it's a whole very big calculation. And the reason is so that the community spouse, the spouse that is not going to be living in a nursing facility. Now, I'm going to say institutionalized very often because that's kind of the verbiage, the way we speak about it, but it's not, please don't take offense to that. We're talking about nursing home care, okay? You have a community spouse and an institutionalized spouse. The point is, with these kind of limits on income, etc., when you're married, you kind of have things together. So at a certain period of time, that can be separated. And to be separated, we're not going to impoverish the community spouse and make him or her spend everything they have to reach these limits, so that the institutionalized spouse can become Medicaid eligible. Because Medicaid, if not today, I'll say soon, will be the largest payer of nursing facility services in Kentucky. Because Medicare only takes you so far, and then it's all Medicaid. Now, there are ways, and we'll talk about that. There are ways to kind of work on this. I can't remember if it's, okay. And we'll get to the ways to kind of protect some of your income, make sure you have the ability to, there are a lot of things you can do to become eligible for long-term care benefits in Medicaid, even if you have more income and resources that we talked about just then, okay? Yes? Oh, yes, certainly. Sorry. So when I talked about the community spouse, the question is if there's a child who lives in the home as well, do those community spouse rules still apply? No, they don't. They do not. But if you have questions about that, it's one of those things that there are some things that can be done. Okay. I wanted to quickly kind of go through the Medicare savings program, because you might not need long-term care benefits. You might be old enough to be getting your Medicare, because I'm just this close. But you might not have a lot of income. You might not have a lot of resources. And I was shocked to learn that I have to pay stuff for my Medicaid, my Medicare, Part A, Part B, etc. I thought I'd already earned it and paid for it. Oh, no. There are probably plenty of you that know that. So, notice the acronyms, okay? I know a qualified Medicare beneficiary as a QIMBY. I know the specified low income Medicare beneficiary as a SLMB. Now the other ones, you know, you can't really do it, so it's a QI and a QDWI. There aren't very many of these individuals in this program. We don't have a whole lot of QIs, but we have some. Now, Medicare savings programs are not actually Medicaid. And ma'am, if you got the information there, these are these slides. So, I mean, you can take all the pictures you want to, but those are the slides. And the reason I say this is not actually Medicaid is because by themselves in the Medicare savings program, Medicaid will pay premiums for you, but you don't get Medicaid services on top of that. Okay, the question is, how do the Quimby how do these Medicare savings programs work with the drug benefit? I'm going to get to it just in a little bit, but there is, so for every, I'm sorry about the asterisks. I took them off the other pages. I forgot to get all the way back to this one. It's just to say that they change every year, or they can change every year. That's what it means. These are the monthly income limits and resource limits. As I talked before, for adult Medicaid, you have to have a resource test. For Medicare savings programs, you also have to have a resource test. But notice how much more it is, except of course for the income. Quimby. Medicaid will pay for Part A premiums, Part B premiums, any deductibles and coinsurance and co-payments. So you have your Medicare Part A, your Medicare Part B, and we'll get to the Part D in just a couple slides, okay? SLMBs, only Part B premiums. Okay, so the question is, how often do you have to qualify or certify? For all Medicaid, and including the MSP program, there's an annual recertification. So it's an annual sort of thing. If you happen to be, your only income, say, is from Social Security, and you're on Medicare, and we're able to verify that through our federal hub data, and even your resources, we're able to electronically verify that. You don't really have to do much. You have to get a piece of paper, and even if we can't, you get a piece of paper that says we can't verify your income or anything, and then you might have to either upload some documents or send some documents back, but it's annual. Yes, if we cannot passively renew you, which is what we call it, which is to hit the hub and check all the information and you're still eligible, then you have to do something. If we can, we'll send you a letter and say, good news, you're recertified for another year, everything's great. If we can't, you'll get a piece of paper that says, oh, we tried to recertify you and we can't. We need some more verification on this, this, and this. Don't talk about SSI, that's a different thing, please. Or I can talk about SSI, but that's different than what I'm talking about here. So I'm talking about retirement, RSDI. I'm sorry. I'm sorry, little fella. So SSI is different, okay? With SSI, you get Medicaid, period, even if you have Medicare. But if your income is something that we can verify looking at federal data resources or your income tax return, and it's within 5 or 10% of what we have listed, or 5 or 10% below the eligibility level, then we can renew you with no problem. It's just an annual re-verification that your income hasn't changed, somebody didn't leave you $1 million, blah, blah, blah. Okay? Yes?
I have mother-in-law that has SSI and Medicaid.
Uh-huh.
I guess she's got Medicare Part A. Now, does she need any other coverage beyond that for her medical issues like Medicare Part B?
So, when my mother was still alive and very ill and really poor, I believe she got SSI. No, she got Medicaid. After she got Medicaid, she had the best medical care that she had had most of her life. And that's because if you have Medicaid today, all of your health care needs are pretty much covered. Now, if you need an SSI, with SSI, Medicaid comes. When Social Security issues the SSI determination, they issue the Medicaid eligibility. So you don't have to apply for it. We get a file from Social Security Administration that has a little checkbox beside it, and you get Medicaid. We keep getting that file. You keep getting Medicaid until that file comes and says that you've lost your SSI. So she should be fine. It's what I'm trying to say. Yeah. She should be fine. Now, let's see. Let's go on. Slim B, QI, this is it. Again, Part B premiums only. QDWI, this is a little bit different. You're working disabled and you're not getting Medicaid, and you meet these income and resource limits, which you see they're higher, again, you can, oops, I guess I didn't put in that slide about every one of these Quimby, Slimby, QDWI, and the QIs. Every one of them have, get the Part D premium paid as well. So you'll have your A, B, A or B, A and B, and D paid. We call that buy-in. So we'll pay the premium. It's cheaper for us to pay your Medicare premium than it is to put you on Medicaid. Okay, now let's get back to long-term care benefits and how you can, what you can do to protect some of the resources that you might have. You might not be able to protect many of them. Once again, we've got a form. PA, I believe, is public assistance. This is a form that came from DCBS. So it's a form that's, if you're online and you're in Benefind, it's in there. All of the information is in there. If you want to take a look at it before you go online, it's kind of a checklist of all of your resources and what you might have and what you might need to consider, what you might need to have verification for. Because we can't just say, okay, sure, thanks for telling me that this is your income, but I need to see it. And these are some of the things that count as resources. Note, annuities, trusts are here. That'll be some ways to think about a protection of assets, but it might be income. The question is, how much can you have in your burial reserve? So there's a simple, easy thing to say $1,500, which is really not enough. However, if you have a prepaid, non-revocable burial funeral plan, it can be much more as long as it's not $100,000. It has to be reasonable. Somebody in DCBS will look at your prepaid burial plan and make the decision about whether or not it's reasonable. If it's not reasonable, they got to send it up to Frankfurt, and the people on the third floor decide in DCBS decide if it's reasonable. If they don't think so, they'll send it up to me and we'll look at it and say, really? People think they can do this? Okay, so you want, if it's going to be $25,000, you want to make sure you have an itemized listing of all the services. You have each cost and everything well documented. Okay. Now, you were going to ask a question? No, I'm sorry about that. Yes. Okay, gifts given in the past and how they might count as resources. Good questions. Let me think. Okay. Now, you can't give away your resources and be eligible for Medicaid. So if I have $100,000 in cash and I'm getting ready to go to the nursing home, and I have a big farm, and I have this, and I have that, you can't give it away to your kids and think that's okay. That's not the way to protect anything. Because we're going to look back 5 years. We look back 5 years from the date of your application and say, have you given anything away for less than fair market value? So I can't give you the house and expect for Medicaid to pay for your nursing care. I can't give you the farm and expect for Medicaid to pay for the nursing care, no matter how long that farm has been in your family. No matter how you want to cry and say, we have to keep this in our family, it is blah, blah, blah. I understand those emotions. I'm not trying to discount those emotions. Yes, ma'am.
I don't know whether you're getting ready to say this or not, but it's put in an irrevocable fund, and it's past the 5-year waiting.
Past the 5-year look back, the question is if it's in an irrevocable trust and past the 5 years, does it count? Past the 5 years, we don't care. So,
No matter what.
get the farm before mom or dad has to go to the nursing home. Yes?
There could be consequences to just giving the farm to a family member as well.
Oh, yeah, there are all kinds of consequences. You're talking about family stuff and parents going into a nursing facility. It's a terrible time. It's a terrible time wrought with a lot of emotions. Probably up there with the death of that parent, okay? And we're going to throw a whole bunch of complications into it. I'm sorry. I'm from Frankfurt. I'm here to tell you how complicated it can be. But if you're eligible for adult Medicaid, let me say this, and you have more income than we allow, you can put that income into a qualifying income trust, which is a bank account. You can go to the bank, they'll set it up, they write on it, qualifying income trust. You have to bring proof or upload proof. The income that is over the limit, so if the limit's, I don't even remember what it is, $2,250, and you have $300 more income, you've got 20, whatever that would be. I don't do numbers, I'm sorry, $2,550. The excess goes into that qualifying income trust and sits there. Okay, very limited payments can be made out of that qualifying income trust, or you could put all of your income in there, because if you have more income, but you're under the resource limit, you have what's called a patient liability responsibility. So if I have more income, it's 22, I wish it would be a round number. Okay, if it was $2,000 and my income was $3,000, I have a patient liability responsibility to the nursing facility of $1,000. The $2,000, that's not spend down. $2,000 goes into the qualifying income trust for other reasons. And you only get to exclude $40 a month for your personal needs allowance, which is not a lot of money. Goes into a nursing home account. They help you kind of manage that. So you pay money to the nursing home for part of your care. And that's one way we get around it. And that patient liability can be zero, or it can be, I've seen $2,000 patient liabilities. Okay, that's what you pay. It's not on top of your nursing home cost. We deduct that amount from the nursing home when they submit a claim to us. Okay, so it's not all, oh, I've got income over this, I can't qualify. You need to kind of go through the whole process and see how it works out. Yes. Generally 6,000. Mm-hmm. I think that's kind of an average. Oh, I'm sorry. The question was, how much is about as a nursing home stay now for long-term stay? Not rehab. We're not talking about rehab. We're talking going to live, moving. If you have a house and you want to keep your homestead and it's where you lived, you have to give us a statement that says you intend to return home. Never happens. No, I can't say never, but generally 98% of the time it doesn't happen. Or we're trying to sell the house and just hadn't sold yet. When that house sells, it will be an asset to you. It will be a resource. And we'll kind of quit paying your Medicaid for a minute and you'll pay it. Or if you've already incurred that much debt with us, we can just go ahead. I don't know if we go ahead and take it or not. But
Can you repeat that? Sorry, I was thinking about the house thing. So would everyone just sort of
okay, so the question is, when then everyone just tell us they're going to move back in? That is a huge loophole that I have to say we have not been monitoring very closely for a while, a good long while. And so we have just recently picked up a monitoring program for that, and we're going to cut those off after a year or so. So you can't just keep, because we have some people that have just kept saying, I intend to return home every 6 months. Yes.
well, if they never return home, then you get home.
Well, right. We don't want the home. We'd rather you sell it, have some benefit from the proceeds. But yes, if you have anything left in your estate when you pass, there is estate recovery for the cost of your care, not just sweeping away everything, but the cost that Medicaid has paid for your care. Okay, now let's see. These are some of the documents that you might need to have handy when you're going to be applying. This is not the remote control. When you're going to be applying for long-term care Medicaid. The things we have the most trouble with getting: health insurance verifications. So if you're planning, if you have that luxury, get it. Get it while the owner of the life insurance policy can still sign a piece of paper or talk on the phone. Because if you don't get it, we're going to deny you. We have to have that. If you bring us a life insurance policy, we have to have some verification, or if we find it somewhere sitting. Life insurance, usually, right. No, we're not taking it. Okay. We have to have verification that it has no cash value, because if it has I mean, I have a life insurance policy that has a cash value. Okay. That's a resource to me. I can access that resource. Right. The cash part today. Call them up, say, give me the cash part. That's a resource. Oh, yeah, I see that. Yes, sir.
Okay. Say I'm the owner of the policy on the person that's the subject here.
Right. So you have a life insurance policy on me, right?
I'm the owner of the policy.
And you're the owner of the policy. It is not my asset.
Okay.
It is not my resource, because I can't get to it. You own it, not me. Okay?
What if you have that insurance policy, you switch it within the 5-year?
You switch it from cash value to no cash value. Is that what you mean?
Yeah, I have an insurance policy, but then I switch it.
Okay.
Where my son.
Too specific a question for me to answer without looking at your document. Okay. But if you give a cash value away, that could be a transfer of resources and you might have a penalty. So you can be eligible for Medicaid, get a penalty because you've transferred something. And so you have to pay or sit in a private pay bed until that penalty period is over. And then your Medicaid will begin. And the penalty has to do with the daily cost of the service and how much you transferred. And to give the farm away and the farm is worth $100,000, then we're going to penalize you for $100,000. Okay? Clear as mud. That's about how clear it is too. Exclusions. I already mentioned the qualified income trust. So if your income is more, put it in there. You can pay your patient liability out of that qualified income trust, and then it's done. And you know it's reasonable. Medicaid has to be a beneficiary of that. Your resources that you can protect. Your homestead and irrevocable funeral trust or agreement. Irrevocable trust, but you can't go and take all of your estate today and put it in an irrevocable trust and go to the nursing home tomorrow. Why? I didn't get any value. I didn't get any value for putting that in my resources in the trust. Okay, so if I put all of my resources today in an irrevocable, just a regular trust that's irrevocable, that will pay my children, okay, for whatever, okay, and it'll be a document that will be this thick. I have put all my resources into the trust and I'm not getting any benefit from them. Nobody paid me. I gave them away. Now, because I gave them away and put them in that trust doesn't mean that, doesn't turn them into somehow an excludable resource. The trust itself is excludable. I don't have those assets anymore. I don't have those resources anymore, but I gave them away. Because I gave them away and I got nothing of value in return, I'm going to get penalized for it. So 5 years, you think you're going to stay out of the nursing home, or your mom's going to stay out of the nursing home, or your dad or your great aunt, do it. If that's what you feel is an important thing to do. But you need to wait 5 years then before you apply. Yes, sir. We're running short. No. Okay, so the question was, can you go into any nursing home, or are there restrictions? The nursing home has to have Medicaid beds. They have to be a Medicaid provider, which is up to them. We pay them what we pay them. It doesn't matter what they charge a private pay person. We pay them what we pay them, and that's based on their case mix ratio and where they are and blah, blah, blah. That's why I could only say, I think you can see the rate. No, you can't see the rates. I think the rates are maybe even posted somewhere on the cabinet's website. Don't know where. Sorry. Yes, sir.
On that, what percent of nursing homes take Medicaid?
What percent of nursing homes take Medicaid? I don't really have an idea on that. I can tell you that there are most nursing homes, is what I believe, take Medicaid. Most. Not all of them. Not all of them. And you can be a Medicaid enrolled provider and have 2 Medicaid beds, and that's all. And you can say, oh, yeah, we take Medicaid, but only in room 7 and 14. And that's how specific it can be. Okay? Yes, ma'am.
Would you recommend hiring an elder care attorney and doing, and actually getting them to figure out everything? What is your specific opinion?
I can't really speak to that. I think that if you are concerned and have a large estate that you're dealing with, hoping that, and estates don't exist until somebody dies. But let's say a whole bunch of property and a whole lot of cash and a lot of resources, and you want to spend $2,000 or $20,000, then that's up to you. That's just what you have to do.
Don't you think a lot of this is very difficult on the front line to really figure it out in terms of what is in their best interest? Or is this something that you can go to Franklin, sit down with you, figure it out? That's what I'm saying. It's very.
Yes, ma'am, I do think, and the question is, would I recommend hiring an elder law attorney to figure out what's in your best interest? Your best interest, is very specific to you and your situation. And so that's why I gave the answer I gave. And so I would not necessarily, like I said, if you can spend the money and you have the resources, it doesn't hurt. Please don't go to just anyone. Make sure that they're reputable, because an attorney can give you bad advice and you're still stuck with it. You're the one who will be stuck with the bad advice. So make sure they're reputable and do it.
Because, don't you think this is possible? Somebody to understand. You almost have to go to school to understand.
Okay. That can be a function of a couple of things. Okay. It can be a function of me not being able to explain it to you, to sit down with you, to go through your papers and to say, this is what you need to do. It could be a function of that. It could be a function of how well I've explained what I've explained. I want this to be easier. There's nothing more that I have worked harder on in the last probably 4 years to try to make this easier. Because like I said, it's hard. You're going through a rough time. You don't want to have to take off work, go to the DCBS office, sit for hours waiting for an appointment. So we've tried to put a lot of the questions and as much into the self-service portal as we possibly can. Yes, it can be complicated. And if you're concerned about making sure you protect your assets and you have the resources, it doesn't hurt. Okay? I think most people can understand it if you just go through it a step at a time. Yes.
So the Medicare savings program, you have Medicaid case for the Medicare benefits and you only get
Medicaid pays the premiums that you would pay that would be deducted from your RSDI or that you would pay if you don't get that. And you get what Medicare services, what Medicare benefits come with those A, B, and D. Okay? You don't get Medicaid services on top of that. However, if your income and your resources are low enough and you have Medicare, you can be a Quimby plus or a Slim B plus or something. There is a certain low level of income where Medicare and you're aged. That's the term, aged, 65, not that aged, but aged. You might get. You might be a dual, full dual, we call them. Full as in gas tank full and dual as in dual coverage, Medicare and Medicaid. So it's possible. If your income is just really low, and I don't mean the QDW, the Quimby income, I mean low enough for Medicaid as an individual, not the 2,000. Okay, are there questions on the chat? I'm very sorry. I think, right. Okay, so if you're going to be applying for your mom or anyone, let's get a MAP 14 off of the website, sign it. The only time that you don't need one, a MAP 14 allows you to be an authorized representative. We can talk to you about things that are going on. You have access in Benefind to that case. Please don't go on and pretend you're your mom, okay, and that you're applying, because you might not make it through. And if we find out, that's really kind of fraud. Okay, so if you want to do this, if you're the daughter and you want to do this for your parent or your spouse, get that, not your spouse, you don't have to. It's that legal recognition of marriage that means I'm you and you're me. Okay. You can do it. You just get a form, you get it signed. You go ahead and you can start your application. You can fax your MAP 14 into the DCBS office, and sometime within 15 days, they're supposed to associate you in the background. But you can go ahead and begin the whole process. Now, somebody at DCBS still has to work the case. So you hit submit, and they've got to verify your documents and make sure you didn't upload a picture of a cat, not a real cat, sorry. So it won't be instantaneous, but you don't have to go there. You might have to, but you don't have to. You're not required to go there. These are the improvements we made last year. Passive renewal, I think I already spoke to. And if you want to know what kind of services the nursing facility will give you, it's in these regulations. You also have to meet patient status, they call it. We call it level of care. So I can't go check myself into a nursing home and live there the rest of my life as I am, even if my income would allow it, and have Medicaid pay for it. I've got to be in need. The services have to be medically required for me. And that's it. That's it. And I'm sorry I took longer. Go ahead. What's the question on Zoom?
Online, the person asked, what is the timeline for Medicaid application? Can someone be found eligible, say, 6 months before nursing home care is possibly needed?
Okay. So part of that goes to the level of care. So if it's needed, and you apply for, you can't get long-term care benefits from Medicaid unless you meet that patient status requirement, which is I medically need the services. Okay, so you can't apply now expecting that, you know, your mom or your husband might need to go into the facility. You have to apply when they meet that, when you think they really need it. Okay, they have to be in the facility 30 days before the actual, we're gonna say you're eligible under the special income limit, which is what I showed you. It's a special income limit. That's a federal requirement, but it goes back to when you applied. Okay, so 30, and all the nursing facilities know that. They know to apply, they know to wait, and not to send that first claim until after the 30 days is up. Yes, they get paid. They get paid, yeah. So, yeah, it goes back to that time. The only reason that I hesitated for a moment is this. If you gave away a whole bunch of your stuff and you're going to get penalized, but you still have plenty of money to sit in a nursing home in a private pay bed, there is a judge who has ruled that we have to allow you to serve that penalty in the private pay bed. We used to believe that you had to serve it in a Medicaid bed. You don't. So if I'm over in a private pay nursing home that is not a Medicaid provider, we have a manual process to go through to get that level of care issued, because the level of care is a segment in your eligibility. We can't deny your eligibility because of where you want to serve your penalty. If you meet the level of care, you can serve out your penalty time in a private pay facility, and still, once the penalty period is over, still move into a Medicaid bed. Okay. Remember, people in a local office might use different words than I use. They might say, oh, you're not eligible because you have this penalty. Okay. What that means is we're not going to pay for your services until you serve out this period of time. You don't have to reapply. You don't have to come back, even if they say so. Don't believe them. It's not true. I'm sorry I've gone over my time. I apologize. Okay. I hope, you know, if you have serious questions, if you have problems, if you really, really need to ask me a question, my email address is lee.guice, lee.guice, yes, juice with a G, @ky.gov. Please don't expect instant response. I'm beyond that these days. I apologize.